this is just a really good sort of intro to what we do. So, you know, have a watch and while I bang on about what physios do, but it's kind of giving you an idea of, like, we try to bolster the tissues to their best state to heal. And, you know, the foundations for that are pretty basic, hey? Like, if you've got good nutrition and are moving within the limits of pain-free, like, are you going to get stronger and well? Yeah, it stands to reason that that's the way it works. But, you know, life sometimes gets a little bit more complicated, and, you know, you have surgeries that you try to recover from, so the body's, you know, really at a point where it requires a little bit more healing. Come here, mate. Yeah, of course. That's not like a Labrador. So, yeah, some of these animals are amazing. More posture, oh dear. So everything from ergonomics, everything from applying biophysical sort of stimulation, like your TENS machines, have you heard of those? Ultrasound, yeah. Acupuncture is something that I absolutely love. Like, I think it's amazing. You're going to have responders and non-responders though, and you see straight away with the animal whether or not they're a responder or not, and I think that's super cool because, you know, the animals don't lie. Like, you know, you can't use your Jedi mind tricks as a physio going, oh, that makes you feel better, doesn't it, with an animal? Because they're going to go, I don't think so. Like, yeah, I'm going to either bite you or scratch you or claw my way out of this if it's painful. So, hydrotherapy, that's another one that I absolutely love. Like, Bugsy was able to get on the underwater treadmills. Have you guys heard about the underwater treadmills for rehabilitating animals? Like, so they work really well for the spinal patient. Once the surgery site's healed, it looks like a big submarine door that they close on your gym treadmill. It literally is a gym treadmill, and it fills up with water, and it takes away the weight of them, you know, in our gravity's forces by that buoyancy. So, you know, filling up the water to the knee takes away about 10% of their body weight, up to here 50%, and then up just a little bit higher at the hip and pelvis, that'll take away so that they've got 90% weightlessness and they're able to walk. So, you know, the studies were actually done. Oh, it's so tough being you. he's so used to this. He's 10 years old and just, he's going, oh, not the massage course again. You're all right. Now, what I might ask kindly is, now that I've got him settled, I have to come up. Right. So what we're going to do is we're going to go through range of motion exercises. Elaine touched on some really cool things already with range of motion and that whole myofascial sort of conversation. A really interesting podcast that I've been listening to of late has been Daniel Vitalis, and he's like a natural movement sort of speaker, or everything nature. And, you know, we really don't know much about fascia. Like, there's not research that we can really kind of say, you know, it has this big effect. But it's almost now becoming to a point where it's like the skeletal system, it's like the muscular system. It will essentially become its own body part of the system that, you know, that we as organisms have. And like it's really exciting because, you know, we're getting more and more technology to be able to see and you know, get excited and have a better understanding of all of this now. So the fascia, you know, it has it's almost like this matrix all the way through the body that's encapsulating all the things that are movement, and you know, it has to have an effect when you really consider it. Range of motion is the sort of, it's a descriptor, like we use it in physio to describe what a joint can do, as much as it is a therapeutic input as well. So I'll run through what it actually is. We're going to understand it primarily in this setting as a technique. So it's going to be another part of your, you know, cool tools that you'll learn over the weekend, which is really exciting. I'll describe the types of range of motion so that you can actually go away and go, so I can put this in as an exercise or as a prescription for this animal or for a treatment modality. The indications for when it can be used, we'll discuss a little bit of that, which is pretty exciting. And we've already touched on the familiarity and handling from a safety perspective, but I'll reiterate it and, you know, make sure that you guys are looked after, because it's pretty important. And then just the outcomes of what range of motion will do. If you're doing an intervention, it's got to come out with an outcome. So it's important to understand these outcomes and, you know, the reason why we do it. So we'll go through that. And then just some other considerations and precautions to consider. But the most important part is getting your hands on. Like, I can't wait until, when do we play with the greyhounds?
Today they're coming at 11.
Yeah, cool. So how far away are we from them?
We have an hour.
Excellent. Well, I'll show you take notes while we're going through this to kind of get an idea of how you can formulate a plan, because I think I said it to the group up the back, when you're working with an animal, you can't really work on them like a human. Come on, lie up on the bed, you know, yeah, just relax. It's, you know, they've got attention span of sometimes short, or otherwise they're just going, man, this environment's not safe at all, I'm out of here as quickly as I can. Alright, let's clip on to the next one. So, range of motion, it's described, it's first described in orthopedics. So that's the area of muscles and bones, and primarily surgery came from like the term straight child. It actually means in Latin. So ortho meaning straight, padlion meaning child. So they describe it, each joint in the human body has actually got a specific range, and what we mean by range is it's done in degrees, so from 0 degrees through to 360, looking at a specific anatomical position. So we know that, you know, the elbow actually goes through 125 degrees, from straight being 0 and all the way through to around about 125. All right, and that's what we know. The shoulder joint again, 365 degrees of circumduction. So we're using it as a descriptor as much as anything else. So does that make a little bit of sense where range of motion has actually got a term? There's functional patterns and specific ranges. So we know that we call like the movement pattern is actually, if I was to bend my elbow, what do we call that?
Flexion.
Yeah, awesome. You're on 25 points. All right. So the opposite to that is? Extension. So I described before a full circle of the shoulder. That's called circumduction, because it's like a big circle, and that's just all the Latin names, you know, medical, we're pretty good like that. We make things a little bit more tough, you know, to describe so that we can sound really smart. Now, a joint's movement is dependent upon its surface. Now, when we look at each joint, and when we're talking joints, we're actually talking movable joints, so synovial joints. Do you guys know what a synovial joint is? Okay, cool. So, on the ends of moving parts, on the ends of the bones, there's cartilage, and it's like this, you know, really nice articular surface that's actually quite spongy on the ends of the bones. Now, that surface has got some lubrication in it once it's warm. And once it's warm, synovium, which is the cells that are in the capsule and on this articular cartilage, they secrete synovial fluid. And that makes it so that it's all nice and nutritious, so that it can move, and that viscosity actually makes it so that it's not going to be grinding away. So arthritis, you know, when you hear a joint start to grind away, that articular cartilage has started to wear down, and there's not so much of those synovial cells to actually put in there. So what we try to do is we slowly try to warm it up, and as much oil or synovial fluid gets secreted into that joint to actually move it a little bit more freely. And that's how synovium works.